I want to talk about things that I found in doing cosmetic treatment. What I realized is a long time ago, if you don't understand occlusion, and I'm going to spend the first part of this presentation giving you my view on occlusion. If you don't understand occlusion, your case is going to fail. And this is a case that I did. Spent a lot of money to take a course to do this, and it was on my sister-in-law. And after 2 years of doing it, the case failed. And you can see crowns are knocked off. I didn't prep that margin up there in 2 years. The gum recession and abfractions were obvious. Porcelain chipping. At the time, I didn't understand vertical and the Shimbashi measurement. This patient had a 12 millimeter Shimbashi, which we've heard quite a bit now about the necessity of having quality vertical. And in 2 years, you could just see that this was breaking down. So now, this was done to the patient's habitual bite. So now, if you believe that a habitual bite that's not proper can break down this type of case, how are you going to restore these kind of cases? And I'm not speaking from a holier-than-thou attitude because, quite frankly, I do routine dentistry. I still restore to habitual bite. I still have to earn a living. But the only difference between me now and when I first started this is at least all of my patients are informed. And they're advised of optimum treatment. And a lot of my full mouth rehabs, they're advised of orthopedics and orthodontics. But, I deal in a world that's pretty poor demographics. And, I got people that are construction workers. And so I do whatever they agree to, but I always advise of the best. But how are you going to restore this case? The existing habitual occlusion is obviously breaking things down. Missing posterior teeth, a ton of flags. When you start looking at intraoral flags, they're all over the place. How are you going to restore this case? Size of wear? Or how about this guy? Patients get apathetic after a while because they've been coming to a dental practice for 20 years or more, and every year or every 6 months they need a new crown or a root canal or extraction. And basically they evolve to this state. And he has, complied with what the dentist told him to do. But then after a while it's like they get apathetic because it's like, nothing's working and everything's breaking down. He has what I call a roller coaster bite. And if you have that kind of an occlusal plane, your muscles are going to have to go through muscle gymnastics to facilitate that kind of occlusion. So, and what's really cool about it, and that's what I really loved about when I was learning TMD, is I went to several doctors, and when I started hearing common themes from different lecturers, that I knew there was truth in that. And that's the way occlusion is the foundation that applies to all the disciplines. You can have occlusal problems with the restorative, or you could have occlusal concepts that you need to understand in dentures, orthodontics, obviously what Brenda was just talking about. I can't tell you how long I was doing case types for periodontal disease that I thought, and in reality I'd have my hygienist root planing teeth that had 2 millimeter or 3 millimeter pockets with perfect gingiva. I'm going to show you a case. It was occlusal disease, and I missed it. So proper occlusal design is necessary for longevity. Restorations, this patient had occlusal trauma. And, he had perfect home care, but occlusal trauma caused that bone loss. You need to understand jaw joint function, and occlusal design will help support jaw joint function. And this is a typical patient that I have. A patient that has chief complaints of headaches, ringing ears, neck pain, jaw pain. One of the reasons that I do so many full mouth rehabs is because this is my baseball farm club. They're the double A's, because when they get through a phase 1 and you stabilize their symptoms, now they can justify high-end treatment. And if they have really trashed out teeth like the guy I showed you earlier, then a full mouth rehab is necessary. If they have nice teeth, then you do ortho. But proper occlusal design is necessary to treat myofascial pain. I'm always examining and diagnosing airways now. And it's really refreshing because when you start seeing everybody talking about vertical and AP when relevant, and then all of a sudden you start looking at treating an airway, you know you have something that's truthful because it's a common denominator that you see.